Good morning. I'm Dr. Binyo. My specialty is combined Western and Eastern medicine, help our patients to reverse their chronic disease, achieve their best health. I'm going to share with you some information. So, I am very blessed that I was trained in China in both Western and Eastern medicine and came to the United States to teach physician and graduate students integrative medicine, how to help our patient get better with less and less medication and better recovery. I did a lot of presentation in the United States and Texas State, the health department, and also I was teaching MD Anderson Methodist Hospital, St. Luke's Hospital, to teach about how to integrate more alternative medicine. So our patient, when they get into the hospital, they can get out faster. And then a few years ago, I also trained in cellular therapy, which we understand that regenerative medicine, like a stem cell, can help treat the root cause of the problems, and it became very, very popular. I was at 2019 International Society for Stem Cell Research, our annual meeting. So we had professor from Harvard, professor, and we have two Nobel Prize winner, Sir John Gurdon and Dr. Yamanaka. So we had a chance to sit together and discuss a lot of very important questions about stem cells. So I really enjoyed combining Western and Eastern medicine to address our health problem. The problem is that conventional medicine is very powerful but not perfect. Neither Chinese medicine. They both have amazing histories and amazing foundation and scientific evidence, but they also have their very specific weakness. But when you combine together, like I work with Susan Komen Foundation, the Breast Cancer Foundation, and American Academy of Pain Management, American Association of Blood Bank. So I see a lot of benefits in terms of combining with both sides together. You can see our team here, Dr. George Camille, he's also our stem cell expert. So we have Dr. Ma and Dr. Neil Riordan. He's an amazing scientist in stem cell. He was the first one to open the world, the first stem cell clinic. And we have MD yoga expert. She has an MBA degree, and we have Dr. J.C. Carlos. He is a specialist in genetic science, and Dr. Zhong. Dr. Zhong both are trained like me and Dr. Ma in China in Western Eastern medicine. Extremely talented young Chinese medicine doctor. So our team to work together is really address our health problem, not just treating the symptoms. If you look at this patient, she's 80-year-old. How many problems she has? She has a lot of health issues from memory, fibromyalgia, and sleep problems, depression. What else? She has very poor bladder control. She has to use diaper, and also she had other issues. So, according to Center for Disease Control, what we found out that our population, the number one problem, if we are age over 65, the first problem is pain and arthritis, heart disease, cancer, diabetes, and sinus problem. So those are the top 5 health problems. Why we have all those health problems? The root of the problem is decline of the stem cell. If you see on the slides right here, when we're a baby, you have almost 100% stem cell in your bone marrow. But when we reach age 50, you have very little left. That's the reason where our vision, our energy, and sleep quality is all declining. Interesting. So you're asking me, what do you mean stem cell? Well, this is what happened. Your skin cell only can survive 30 days. Liver cell, 180 days. Your red blood cell and white blood cell, they only survive 120 days. White blood cell for the 12 days. So that is interesting because that means that your stem cell in your bone marrow can keep you alive If you don't have stem cell, very few stem cells in the body, you can have regeneration problems. Your skin can become wrinkled, your liver not going to function properly. Then you're going to ask me the question, how do we find the stem cells? Because actually, 1945, when the first atomic bomb exploded and killed so many people instantly, more people died thereafter because what? You're right, because radiation killed the stem cell in the bone marrow. 90% of stem cells in your bone marrow are reproducing your red blood cell, white blood cell. The other 10% we call mesenchymal stem cell. So the other 10% mesenchymal stem cells is to regrow your skin, your hair, your liver, your stomach lining, your respiratory lining. So that's the stem cell keep us alive. They come out to differentiate different issues. So with our age increasing, our stem cell declining, that's the reason your healing process is much slower. Imagine Mr. Smith, when he was 3 recover. Now, if he sprained an ankle, how long it take him to recover? It takes a long time because the stem cell really dropped a lot. So you can see here, so we grow from one stem cell, and then from day 1 to day 4, it become an embryo. That embryo actually we can freeze it in our office in the cryo tank. We can preserve 5 years, 10 years. When the woman is ready, we can reimplant this, take the frozen embryo out, warm it up, and then implant in the uterus, grow into baby. So that's how stem cells work. Then the embryo continue growing into baby and into fetus. Once the baby is born, keep it growing from 5 pounds or 7 pounds into 140 pounds is all rely on your stem cell in your bone marrow. So the stem cell in your bone marrow keep you alive, and that's the key thing to maintain your healing. But if we have all kinds of other problems, you can really consume your stem cell in your bone marrow. Another thing we found out that after the baby is born, the umbilical cord and placenta, they also have a lot of mesenchymal stem cell. So now our scientists in our office are stem cell experts. They are using the umbilical cord stem cell injected into your knee joint and regrow your cartilage. Or we IV this person, then the stem cell will be attracted to the place wherever you have inflammation to heal the body. So that's the beauty. At the same time, there's no rejection because there's a first generation undifferentiated the stem cells, so there are no rejection, and it has to be FDA supervised, and every injection we have to report to FDA. So how you could think about this. When you go to high school reunion, 40 years high school reunion, everyone look at you, you look wonderful. They're the same age, but you have great energy, great memory, no pain, and good digestion, good sleep. Why? Because you maintain a higher level of stem cell in your bone marrow, period. So how our stem cell decline is because, number one, you're not eating the right thing. You're not doing enough exercise. You have too many times infection going to the hospital, or you have too much stress and you're taking too many medication and toxicity, and heavy metal sensitivity. So all those things create decline of your bone marrow. So when we treat the disease, we have to address the root cause of the problems. Well, we're in the United States. This is a beautiful country, very powerful country. I love it. If I be God forbid, if I have cancer, if I have major healthcare issues, I'm going to come to the United States to have treatment. But at the same time, for the chronic disease, we really have big problems. Number one, take a look. We do have the highest cost. We do have 911 response systems, the first one, the quickest one in the world. But our average health level is at 37. Why? It's because our lifestyle has to be improved. Second, the medication has to be used as for emergency treatment. If we rely on medication for a long time, what's going to happen? So if you look at here, FDA give us a warning. Like a doctor said, Vioxx, they actually can cause heart attack. Nexium's, that's the very popular acid reflux medication. It actually causes osteoporosis and memory loss. Or about the hormone replacement therapy that was very popular 25 years ago. Now it was halted because it caused what? Breast cancer, ovarian cancer. Besides that, how many of you are taking antihistamine for your allergy? Take it out right here. So the research published in January 2015, it shows that 800 out of 3,500 men and women aged over 65 develop dementia after taking those medications for 5 years, including some of the antihistamines, antidepressant, bladder medication, sleeping medication. Yeah, that's the problem we're facing. So when you go boxing or football player, that's physical trauma. But if you're taking the medication, taking antihistamine or sleeping medication if you're drowsy, that's brain chemical trauma. So that's the same exactly damage to the brain. So we have to change that. What the World Health Organization found out that 90% of the common disease are preventable or prevalent today and cannot be treated by orthodox medical procedures. Think about your arthritis, chronic pain, diabetes. If you take the medication, you feel better. If you don't take it, it come back. So we have to address the cause of the problem because number one, you need to take care of your stress properly, physical, mental, emotional, and we kind of just walk a dog in the car. Not just joke. What about another thing? Big is gut flora. Yeah, if you look at our food pyramid, now you know that this food pyramid need to be significantly adjusted. That's true. Yeah, because when you're taking antibiotics, it kill the bad bacteria, but also interfere your bacterial balance in your gut. This research show you that. So this rat has normal gut flora, so he is not gaining weight. And this one they gave them low dose of penicillin to kill a lot of bacteria in the gut, and then this fat getting bigger and bigger, bigger and bigger. But if plant this normal rats transfer into this fat rat rectum, look, this rat actually start losing weight. So the gut flora is very important. We need to check it out. Besides that, if you're not eating healthy, you have a lot of stress, you create a leaky gut syndromes. So leaky gut means that the junction of the lining between the cells in your intestine open up. So the ingredients, the particle in your intestine, including bacteria, food particles, and toxins, that's a massive damage into your body. Will trigger a massive immune reaction. So now, you know what happened? Terrible, terrible. I agree with you. So that's leaky gut syndrome. Then you can see the tons changed and created all kinds of autoimmune conditions and many other problems, including the skin problems. I'll show you one of my patients later on. Thyroid issues, colon issues, adrenal glands, all those issues. So that's autoimmune response and resulting over 100 types of autoimmune conditions. Just to give you a general idea. That's just this is the thyroid problems. Yeah, your thyroid problem responsible for what? Your bone, immunity, and your weight. What else? And also diabetes and all the different things. So we really need to work on your gut. As a matter of fact, your gut produces 90% serotonin. 90% serotonin produced in your gut. 10% from your brain. That's when we said happy wife, happy life, or happy gut, happy life. Okay. So another thing is about the stress. Stress can cause a lot of change of your hormones, your cortisol level. Look at this patient. The cortisol level, and you're not able to go into sleep. So that's another thing we need to work on that. You can see all those different symptoms, the hair loss, and constipated, depressions, headache, and weight gains, and insomnias, and then end up in different because your hormones are different. When we gain weight, not just gaining weight, it's also shrink the brain. That's another scary part. So our goal for a patient is really to help them address the root cause of the problem. If you look at this, I know, these are all symptoms. This is just the outside manifestation. It's just a symptom. It grew out, showing out, but the cause is right here. Inflammation in the body, your gut issues, So the treatment has to be more address the root cause, has the systems. Will take probably 3 months, 6 months, 12 months, 18 months, but it doesn't matter. We're gonna address the cause of the problem, then those things can gradually disappear. Yes, I'm gonna show you right here what happened, okay? So we call relief care and correction care. Your organ is developed by the stem cell into many cells, many tissues, many organs, and the organ become a system. Yes, exactly. And then your system are connected by the nerve and the blood vessel. You will maintain good function and you feel happy and ease. Now, if you have injury, you have stress, inflammation, toxicity, blocking the circulation, and you interfere the organ's function, what's going to happen? The function will decrease. No symptom showing up yet, and then gradually become what? Disease, correct? Become disease. At this point, then start showing the symptoms. Look at those symptoms at the beginning. How many symptoms you have? Check it out. You have one symptom, two symptoms, you're in the beginning. You have 5, 10 other symptoms, you're in big trouble. So how did we end up with all the issues? Because all the stress, damage, toxin created into the body. When you're born, you probably about 100% function and great bone marrow stem cells. But become teenagers and going to college, and now you're going to take care of your family and your work. So it's a lot of stress and toxins, and then your function gradually drops and declining of your stem cells. That's the bad news. That's the reason. Now you're going to go see a doctor. When you come to see us, I'm going to give you some medication. I'll give you a few acupuncture or some herbal treatment. After a few weeks, you feel better. Think, I feel better. My symptom disappeared. And then you stop the treatment. When you stop treatment, what happened? Gradually the symptom come back. Because what? Because when your symptom disappear, it doesn't mean your function restored. That's the key part. So you kind of just keep go back and forth. So you have to really correct your, instead of just treating the symptoms, you gotta have a correction care to restore your function. So your function can go back up to 65% or more. So then we can give you maintenance. Or the best way is we can add more stems into the body, and then your function can be restored far better. That make the point very clear, very important. Number one. So the key thing, Asian trauma hormone balance caused organ dysfunction at the beginning, but there was no symptoms. Then gradually become disease, a lot of symptoms showing up. When the symptoms showing up, your body already declined for a long time. So when you treat those problems with medication, if you acupuncture treatment, you're just temporarily cover the symptom, you feel better. But then the symptom will come back if you stop. So you have a system to make sure you got your function restored mostly, so you can maintain the level at that point, or we can add in stem cell to increase the function. Yep, that's it. We got to find the cause of the problem, address them, and have a system to help our patients. And so those are the things we need to identify, including food sensitivities, hormones, yeast, gut flora, vitamin deficiency, infection, leaky gut. So all the things we identified, then you'll be so much happier. Exactly. Those are 5 pillars of health: nutrition, fitness, hormone, brain health, and detox. So step 1, we'll do the evaluation. Can spend about at least about 45 minutes, 1.5 hours. And then we need to do the hair analysis to find out the food intolerance, heavy metal sensitivity, or we can use what's going on with your body. Do some of the tests come out. Then we'll do the stool analysis to find out gut flora, if there are any parasites in the body, and any bleeding, all the different things. So hormone test also is very important, as we discussed a moment ago. You can see right here. The cortisol level around the 6 o'clock usually it peaks, so that's reaching, it's time to wake up. And gradually by the evening it declines. So if you can see that if your cortisol is not declining in the evening, you're not going to be able to fall into sleep. So we have to correct that. And then the treatment will be, we can use acupuncture. As you see that I was taking care of Dr. Michael DeBakey, great doctor, and this shows that just with acupuncture help back pain much better than combined medication and physical therapy. So some of our patient you can see right here, this patient headache, it's mostly gone, allergy is gone within 6 months, acid reflux is gone. And her weight was 198 pounds, now it's 148 pounds. Her waist is 46 inches, now it's 35 inches. Sleep, energy, memory, blood pressure, nerve back pain, all much better. So you deserve a great return of investment. So that's our patient's progress graph, what you can see right here. So we use this one to gauge how much improvement you had with your subjective measurement and objective measurement. There's another patient, a great man. He was a veteran. He was dispatched to Kosovo, got blown up on landmine. So he had 11 surgery on his back. Hand pain, foot pain, plus he was dragged on the ground by a car 30 feet. So he has PTSD, sleep terrible, energy miserable, 100% disability. But with our wellness program help, guess what? Now he has 0% disability, he has a manager job, and he's pain mostly all gone. It is possible, ladies and gentlemen. And look at her skin. If you look at her, it's February 28th, 2020, and then after about 2 months, it will become much, much, much smaller. It's still a little reddish, but healing pretty well. And if you look at her arm, it's terrible. It's very skinny, but now the arm is all clean up. So this is another patient who has, you can see that between the bone, the cartilage is almost gone. Then we put in stem cells into the body, our medical teams put in, and then you can see 6 months later, you can see the big difference. And he's very happy because he avoided surgery, he got a certificate. Another patient, you can see right here. So you can see on the left knee is pretty much okay. He did not need treatment, and the right knee is pretty bad. This gentleman, I can play the video, but you probably cannot hear that. So he has diabetes. He lost weight. He was an HA1C 5.7. Imagine A1C dropped down from 9.3 down to 5.7. He's very happy, and his knee has very good cartilage growth. Now he doesn't need surgery anymore. What about if a patient has a COPD, inflammation, arthritis, thyroid problem? So this is what they did. The research, they tag each stem cell before injecting into the body. Then they take a picture 48 hours later. They found out the stem cell attract to the place wherever the body has inflammation. You can see on this person, the right hand has arthritis, so there are a lot of stem cell, but not in the knee, not in the ankle, the bladder and the lung, thyroid. So when you have IV stem cell, it will be attracted to the place wherever you have inflammation. And every treatment, if with stem cell treatment, has to be reported to FDA. That's her. We talked about her a moment ago beginning. You can see that. So she has memory issues, essential tremor, hypothyroidism, fibromyalgia, lower back pain, digestive issues. You can see most things resolved. That's 81-year-old. We're so happy for her. So next one is, how do you feel? If you can resolve a healthy issue, lose 20, 30, 70 pounds, how do you feel? Well, how your life gonna be? The relation you bring to work, enjoy life, play with your grandkids. So are you motivated and really want to take care of your problem? If you are, then we're gonna work with you. Yes, we're gonna do all the several steps. As now you're a good student, you're gonna achieve your goal. Just remember, keep the faith. believe yourself. We are a team to help you together. And here's our gift for you. So if you have any questions, I'm going to give you about 15 minutes mini consultation, or you can come in for our 45 minutes examination consultation. And the usual cost is $287. We will only charge you $137 or $87 for your 45 minutes consultation. I hope you have a great day. The goal is to help you achieve your best health possible. Think about this. If your energy is gone, your diabetes is almost normal, your energy is great, sleep good, and no more pain, how do you feel? Yes, that's our goal. In case you're out of states, we can do telemedicine. We'll send you a special acupuncture cupping set, and we'll also coach you through the Zoom meeting medicine. And we found out it's very, very successful too. We have patients from Chicago, China, New Jersey, Rockport, Texas. So it's working pretty good. Hope you have great health. Just check our website, WeMedHealth.com, WeMed Health.com. And you also can book telemedicine online. We can talk. Just send me an email or text me also. My cell phone number 713-598-1768. 798-1768. Wish you the best health. Bye.